The beginning of counselling is a very important part of the helping process. It sets the tone for what is to come and plays an influential role in forming the relationship between the patient and the counsellor. The first thing to do is to greet the patient when you meet him or her for the first time, usually in the waiting room of the clinic. Sometimes a patient may start speaking to you about her problems even before you reach the counselling room. This can be uncomfortable as the session has not yet begun and other people in the clinic may hear the conversation. If this happens, it may be necessary for you to manage the situation so that the patient's confidentiality can be maintained. At the start of the encounter, before you have reached the counselling room, it is best to either say nothing or else keep the conversation fairly general and non-specific. If you ask a patient in the waiting room how she is feeling, this may be interpreted as an invitation for her to start speaking about her problems. It is more appropriate to wait until you are in the private counselling room before starting such a conversation.
2 additional issues need to be addressed right at the beginning of the session. The first is describing the process of counseling, and the second is explaining confidentiality and its limitations. The following sequence demonstrates how a session may begin.
Hello, Ntombi. Thank you for coming in. My name is Bulelwa. I'm a counselor at this clinic. I don't believe we've met before.
No, we have never met before. I have seen you around though.
Oh, good. I'm glad we're finally getting a chance to meet. Ntombi, our role together is to talk about the problems you are having, which means it is important for you to take part in the conversation. Before we begin, I would like to tell you that everything you tell me will be kept confidential. This means that I will not discuss anything you say to me with anyone else outside the treatment team without your permission. The only time in which I will share anything is if I believe that you intend to harm yourself or someone else. Other than that, everything you say in this room will stay here. Is that fine with you?
Yes, that's fine, Sissy.